ASU events in full swing up there. So good.
All right, here we go. Hi everyone, my name is Jacob Rains. I'm a senior at Denison and one of the co-coordinators of Denison's Voter and Civic Engagement Initiative, also known as EU Votes. Today we're coming at you virtually and also in person from the Vernon Morgan Lecture Hall at Denison for another one of our awesome events as a part of our Denison 2020 election event series. So last Thursday, we around lunchtime covered Black Lives Matter and social movements, and then in the evening, we covered foreign and domestic policy. And this week, we're really thrilled to be talking about a very relevant topic to all of us right now in the election as well, which is COVID-19 and its intersection with the US and global economy. And so today we're joined by two faculty from Denison's economics department, Dr. Kaboub and Dr. Ziegert, who are going to share presentations kind of at the beginning, their perspectives on this issue. And then we're going to leave a lot of time for questions from both our attendees attending virtually and the folks who are here in person. At any time, everyone should have access and be able to send questions in the chat. There's also a Q&A function on Zoom webinars, so you can post your question that way as well. We will see it either way. But to just get us started, I believe we're going to start with Dr. Ziegert. And if you want to introduce yourself a little bit and tell us a little bit about yourself as well, that would be fantastic.
Okay, thank you, Jacob. I want to thank the organizers for inviting us to participate in this series, and also thank you to the students for taking your time to come. I think it's important and part of what it means to be a Denisonian. I've been in the economics department since '97 and teach on issues of income inequality and market failure. And I'd like to share the impact of COVID on the distribution of income with you today. And I hope it's informative. Is that okay?
Perfect. Go ahead. Please share your screen whenever you're ready.
Okay, so COVID pandemic and income inequality. I think it's important to take a look at where we are before, on the eve of the pandemic in terms of income inequality to see kind of the starting point. Some of the most innovative work that's been done in income inequality lately tries to take national income accounts, the income of the nation, and show how that income is distributed to individual households. You can think, for discussion purposes, think about GDP and national income is very close to that. The green line represents what GDP per average adult in the US would look like. The dotted line represents the growth from 1980 to 2014 and suggests that on average.
Andrea, may I interrupt? It could be just me, but we're not seeing your slides. We're just seeing the first slide. Maybe you need to go into presentation mode.
Oh, thanks, Fadhel. That's where
Yeah, there you go. We can at least see the slide now.
Okay, well, let me. I thought I was in presentation mode, but let's just see. Is that big enough for everybody?
If you can zoom, it will be bigger, or you can just click on that icon slightly. Yeah, well.
There we go.
That's good.
Too bad it's not presentation. Anyhow, from 1980 to 2014, on average, adults would have seen a 61 increase in inflation-adjusted income. But of course, we know that the income of the nation isn't divided equally to everyone across the nation. And so if we look at the red line shows that for the bottom 50% of adults in the United States between 1980 and 2014, real income grew before taxes grew at only a 1% rate. So it was essentially stagnant. If we adjust for government taxes and transfers, we can see that it increases just a little bit to about 21%. And so it's important to take a look at the details. This is compares the share of income at the top of the distribution. The orange line looks at the top 1% of income earners, and it looks at how their share of income has changed over time from 1980 to 2014, and compares it to the share of income earned by the bottom 50% of all income earners in the US during the same time period. To give you a feel for this, in 1980, the share of income of the top 1% was 27 times the size of the share of the income for the bottom half of the nation. But by 2014, that had increased to 81%. So on the eve of the pandemic, we really have a tale of two nations, the top of the income distribution and the bottom of the income distribution. Here's another way, a more conventional way probably to look at the same information. It's different data. This uses Congressional Budget Office data. Again, it's adjusted for inflation. It looks at the percent change in income after taxes and government transfers since 1979. And while the details are a little specific, a little different, the story is the same. The top experienced extraordinary growth, and the bottom in the middle less so over the last 40 years or so. So that's kind of a snapshot of income inequality. This slide takes a look at median income. Median income is the income in the middle of the distribution, and again, all the data is adjusted for inflation. It looks at household income by race and ethnicity from 1967 to 2019. So as we can see from the chart, in 2019, on the eve of the pandemic, for Black households, half of those households earned less than $45,000 and half more. For Hispanic households, about $56,000. For white non-Hispanic households, about $76,000, and for Asian households, about $98,000. So that on average, the average median income in the United States on the eve of the pandemic was about $68,700. Well, it turns out that the COVID pandemic is going to make the problem of inequality much worse. Relative to white families, Black and Hispanic families disproportionately face additional challenges that are unique to COVID. In particular, they're employed in industries where they have more face-to-face contact and higher exposure to the virus. For example, Latino men are disproportionately in food processing, and they make up about 44% of the workers who are on the front line in butchering and slaughtering. Latino women are disproportionate in leisure and hospitality industries, and so that's going to affect the data we see going forward. Many of these workers are in low-wage jobs and that have been affected by closures. They work in bars and restaurants, retail, travel, transportation, leisure, and hospitality. So from an employment perspective, as we'll see, these workers face more risk and more closure than other workers. And they're less able to weather the financial shocks of the virus. Finally, Latina and Black families are more likely to live in multifamily housing units. They tend to have slightly larger families. Latinx families in particular often have 3 generations in the household. And so that's a concern in terms of the spread of the virus. And finally, impact on the generation of kids in these households. Many of these households disproportionately lack access to reliable internet and computer devices, and their schools are under-resourced in terms of resources for distance learning. So here's some data on relative cases, hospitalizations, and deaths. And these are ratios of different groups to white non-Hispanic households. So for example, if we look at Black and Hispanic households, they are 2.6 times or 2.8 times as likely to contract the virus as are similarly situated white households. They're nearly 5 times more likely to end up in the hospital, and for African American households, twice as likely to die, and slightly more likely to die for Hispanic households. There's also data there for Native American households who also face similar complications. Now, I want to say something about race and ethnicity. Race and ethnicity are markers for other characteristics like low income, frontline employment, jobs, and other issues. So it's kind of a shorthand in the way that the data is collected to think of because these households disproportionately have these characteristics. It's not race per se that affects some of the issues that are to follow, but it is the fact that these folks have these underlying conditions. So let's take a look at employment. The following information looks at the percent of adults that have been laid off or had to take a pay cut because of the virus or had either or both of these activities. If we look at the first panel of data that looks at race and ethnicity, we see that Hispanic, Black, and Asian households all have faced these kinds of difficulties due to the virus more so than white households. The second panel tells us that younger workers are more likely to be affected than older workers. And finally, it's not much of a surprise to see that middle and lower income workers in the final panel face these economic hardships more likely than those in upper income. Also, take a look at the education. Having a bachelor's degree or more, we'll see is important in terms of how the virus has affected different types of workers. So less educated workers are more likely to be impacted by the virus. So the bottom line is that the workers who are least able to deal with some of these hardships are the very workers who have been hardest hit by COVID. For students, many of you grew up as kids during the Great Recession and probably heard bits and pieces about it growing up. It's important to look at this economic crisis in terms of the Great Recession. And if we do so, we find that the initial job loss was much more severe than the Great Recession. And unlike the Great Recession that affected male workers more than female workers, COVID-19 has hurt women more than men. If we look at the breakdown comparison for Hispanic, Asian, and Blacks, we see that all of those groups were hit harder than were non-Hispanic white households, and that they were hurt much more than the Great Recession, a factor of 4 or 5-fold for women. And again, you can see that similar situations for men. So again, different ways to look at the data. These data are employment, show employment loss. Another way to look at it, it would be to look at unemployment rates. And you can see the dark green bars or dark blue bars that in the best of times, Black men and women, Hispanic men and women have higher unemployment rates than do white men or women. But that those differentials were made much worse by COVID in May of 20. So pre and post COVID, households of color have higher unemployment rate, but COVID has certainly made things much worse. Taking a look at education, workers again without a college education are affected more, but unlike the Great Recession, those holding bachelor degrees were hurt a little bit more, have been hurt more during COVID-19 than Great Recession. But let's focus on the less than high school graduates, the high school grads and some college. Those are some significant decreases in employment. This chart is Bureau of Labor Statistics data that tries to figure out what industries people are in terms of exposure to COVID. They define all different types of jobs and industries into two groups. Those that are highly exposed and those that are not highly exposed. And then they attempt to look at how that distribution of employment jobs is spread over different demographic groups. If we look at this slide, it appears that folks are almost equally likely to be in either a high exposed job to COVID or not highly exposed. The lines are about the same length. The exception might be Hispanics. Hispanics are more likely to be in a highly exposed industry than are non-Hispanics. But this chart would lead us to believe that people are about equal at risk. Though it's important to cut the data in different ways. This looks at the same data, but now it looks at the data by different points in the distribution of income. So we can look at the lowest fifth of income earners, the second fifth, the middle fifth, the fourth, and the top quintile. And the blue lines are the highly exposed. So you can see that the workers in the lowest quintile, income quintiles, have the highest exposure. And that's the case all the way up just through the middle quintile. On the other hand, you can see that at the top quintile, the top quintiles are more likely, top quintile workers are more likely to be in not highly exposed in jobs or industry settings. And the number of people involved are not inconsequential. So if you look at the data now, looks at families in which 100% of family earnings come from highly exposed workers. In the bottom quintile, that's 3 million families. And the second quintile, an additional about 1.75. In the middle quintile, another 1 million families. So if we look at low and middle income earners, nearly 6 million families rely solely on earnings from highly exposed jobs. Well, one of the reasons why workers at the top of the income distribution are a little bit protected and workers at the bottom of the income distribution are not, is that if we look at, this is again, BLS data, but from a different data set, we can see that high school or educated or less, or individuals with some college are much less likely to be able to telework from home than are those with a bachelor's degree. And again, those with a bachelor degree are disproportionately in low contact jobs. So the ability to work from home is not one of the characteristics that or one of the opportunities that many of these workers have. In America and the United States, healthcare is often attached to employment, and so losing one's job can mean losing one's health insurance. And we can see that enrollments have in fact been more, have fallen more for Black and Hispanic households than for their non-white counterparts. Okay, so economic impact of COVID, so those are all the employment effects, and as we might expect, it's going to make economic survival much more difficult. So how are people coping with the impact of these employment effects? Some of the things that people can do is they can use their money from savings or retirement to pay their bills. We can look at people who had trouble paying their bills, who maybe have visited a food bank, or folks who are having problems paying a mortgage. So if you can look at the middle panel there, you see again, households, non-white households are disproportionately undertake these kinds of activities or have to do this, have problems with rent. And again, it's not surprising if we look at the distribution of income that these effects primarily affect low and middle income households, where many of these households are in the distribution. This is data that came out, the survey data that came out very recently, the week of September 2nd to 14th. It looks at Black and Latino households and food insecurity during the pandemic. As many of you know, the CARE data and much of the CARE data expired in July, and we're beginning to see that without additional kinds of support, households are really having problems with the basics. And you can see nearly 20% of Black, Latino, and other multiracial households are facing this kind of insecurity. Again, more than double that of white non-Hispanic households. 1 in 6 renters are not caught up on their rent in the United States, which many economists are concerned about. Evictions, increased the number of evictions, which can be put on hold, but eventually at some point will be a problem. And homelessness is a problem that's very difficult to recover from, and it's particularly difficult on kids. And so we can see that problems paying rent is just, again, disproportionate with the groups that we're interested in. They face those problems higher than white non-Latino households. The next generation of kids in these households is at particular risk as well. 1 in 3 children in renter households face either food and housing or both. So nearly 40% of kids in these households face problems with the basics. And this is a bit of a complicated chart, but it shows different racial groups. The Black is American Indian and Alaskan Native. This is Asian and Pacific Islander, but the groups we've been focusing on are the yellow, the gray, and the pink. And this is the percent of kids who are in linguistically isolated households, live in crowded households, have no adult with a high school equivalent to help them, or have no internet or in their household. Given that the COVID has caused schools to make different choices about distance learning and how to deal with the virus, these children are at particular risk for their learning. And And the real concern is that they're going to lose ground relative to their more advantaged peers. But what about the folks at the top? I'll just finish with them so to get a snapshot and try to tie together what's been going on. So this is from Opportunity Insights, Raj Chetty and Henderson's organization at Harvard. They've been trying to track consumer spending in real time. And if you look at the green lines are consumer spending for the top of the income, the top 25% of the income distribution. And the blue lines are spending for the bottom 25% of the income distribution. And you can see that when COVID hit, spending dropped, but with the help of the CARES Act, the bottom of the distribution tried to keep its spending pretty much on in line with what it had been. Now, going forward, we don't know since CARES Act has not been renewed. But if we look at the top, you see a dramatic drop in spending on the part of households. And Chetty's done some work at where this spending occurs. The top of the income distribution, guess what, is not going out to eat in a restaurant, is not going for entertainment and expenses, is not taking trips and traveling. It's exactly the industries where some of our low-wage workers depend on their livelihood. So the decrease on the spending by the top of the income distribution has put the employment opportunities of folks at the bottom at increased risk. And finally, if you would like to know about the very top, billionaires' wealth grew by $850 billion during the first 6 months of the pandemic. Estimates for Jeff Bezos at Amazon are that if he could give $100,000 to each of his 800,000 employees, and he would still have more money now than he did at the beginning of the pandemic. In previous eras, when defense contractors, for example, during the war, made profits in their production, we had what was called an excess profits tax. So I'll leave that just as a thought, whether in fact, at this point in our history, do we need an excess profits tax? And so I'll end there.
Thank you. That was a really helpful overview. And if we could switch screen sharing now and move to our next presenter, whenever you're ready.
Yeah, thank you. Thank you again for the opportunity, and for those of you who joined us online or in person. It's a pleasure to do this. Just confirming that you can see my slides right now.
Yes, great.
Yeah, absolutely. Okay. So I wanted to, in the next few minutes, share with you, discuss with you some of the opportunities, challenges facing us in this recovery. And I'd like to make the case for a more sustainable, prosperous, and equitable post-COVID economy. And as we've seen from Dr. Ziegert's presentation, inequality is a structural and persistent problem that's been around for a long time, and it's been getting worse. So I wanted to share this one particular slide just to amplify what we've seen so far, and to make the point that if we don't do anything structural to undo these the mechanics of the existing system, it's going to continue on the same path. And I want to argue that we haven't done that yet, and we need to. So if you look at this chart, this is looking at who gains from the recovery. So after every major recession that we had in the US, and this is recovery, not the recession. So it used to be the case that most of the gains from the recovery go to the bottom 90% of households, and the top 10% also gain from the recovery, but not as much as the bottom 90%. And then starting in the late 60s and 70s, you notice this trend is reversing. So now we're at a point where with the recovery, the last recovery after the financial crisis of 2008, most of the gains, not actually most of the gains, all of the gains, more than all the gains, went to the top 10%, and the bottom 90% during the recovery lost ground. And if we don't do anything structural right now, immediately, I suspect that as we exit the COVID crisis, that the same pattern will be produced in this upcoming recovery, hopefully soon, and possibly it will be worse. So that's just a data point to keep in mind. And many of you know some of my work. I do a lot of work around the Green New Deal and how to pay for the Green New Deal. So I want to make the case that the Green New Deal is a program that does have structural policies to undo this structural problem. So why do we need a Green New Deal? We have deep structural problems, a climate crisis, which I will not discuss today, but I think most of you are well informed about that. We have a structural inequality problem, socioeconomic exclusion crisis, an opioid crisis, especially in this part of the country, a broader public health crisis, obviously related to the pandemic, low-paying jobs, and unaffordable housing, education, and health. These are serious problems that affect the vast majority of the middle class and lower income groups in the United States, disproportionately. So what is the Green New Deal? It's federally funded, so it's not going to be a burden on state and local municipalities. It's locally implemented in a decentralized way, just like the New Deal of the 1930s was implemented in every congressional district. So there were federal agencies and so on, but the selection of the projects, the implementation, the management, it's done at the local level. It has to be urban and rural because there is a lot of inequality between urban and rural areas in the US, especially when it comes to infrastructure, access to broadband, internet, and so on. It has to be inclusive. It has to be just in the sense of a just transition for workers who will be displaced from fossil fuel industries, for example, from trucking and oil and gas jobs that will be eliminated with the decarbonization of the economy. So a just transition, meaning a job guarantee for people who will lose jobs in those obsolete industries, a job guarantee with decent wages and benefits. It has to be restorative in the sense of restoring a healthy social fabric and economic fabric that's inclusive. And inclusive here, I have to emphasize that the New Deal of the 1930s was not inclusive. It was the United States of the 1930s with segregation and so on. So that's not something that we want with the Green New Deal, obviously. It has to be comprehensive and permanent. In other words, comprehensive in the sense that we can't just do solar panels and hope for the best. We have to, there are so many things that need to be changed at the same time that we can't afford to have kind of a piecemeal patchwork type of programs. We have to address so many of these things at the same time because they've gone, unchecked for a long time. So what will the Green New Deal do? It will create green jobs with living wages and benefits, green infrastructure to decarbonize the economy, affordable housing, affordable healthcare, affordable education and technical training, investment in research and development to build the technologies of the future that will allow us to transition to a green economy. So the big question that I would like to address today is how do we pay for such a big transformative program that will inevitably be expensive? And this is really one of the main oppositions you hear about the Green New Deal, is that it's too expensive, it's unaffordable. we need to settle for something smaller, more manageable. So we're told the government is broke. We're running out of dollars. The rich will never agree to pay high taxes to fund all of this. The national debt is a burden on future generations. We can't keep borrowing. And then you hear the whole thing about inflation and hyperinflation in Zimbabwe and Venezuela and all that. Or you hear the people saying, we borrow too much from China. This is not a good thing for the US. And I'd like to challenge all of these views and demonstrate that this is not how the federal government pays for things. And this is not something that the US government in particular, can't afford. So with that, let me ask this question. How did we pay for World War II? World War II was one of the most expensive programs in the history of the US, and it came right after the Great Depression, the most miserable time in US history. There was no money to be taxed. There was no money to be borrowed, domestically or internationally. So, did the US afford World War II? Of course we did. Did we go bankrupt? Did we cause hyperinflation? Of course we didn't, because we knew how to do it without bankrupting the country, without causing inflation or hyperinflation. But without having to go as far back as World War II, how did we pay for the CARES Act? Who did we tax to pay for the CARES Act? Who did we borrow from, right? If you remember, when the CARES Act was being passed, just a few weeks before that, everybody in DC was saying there's no money for a Green New Deal, there's no money for healthcare, there's no money for education. That's it, those things are impossible. And then all of a sudden, 535 elected officials meet in Washington, DC to deal with the pandemic crisis. They vote and approve the CARES Act, and they literally spend trillions of dollars into existence without taxing anybody, without borrowing from anybody. And on top of that, the president and the secretary of Treasury at the time came out and said, by the way, April 15th is right around the corner. This is when people usually send their tax payments to the federal government. They said, don't worry about it. We're pushing that deadline to July 15th. We don't even need your taxes on April 15th. So the point that I'm trying to make here is that the federal government doesn't spend in the same way you and I spend, in the same way that states, local cities, and municipalities spend. You and I have to earn an income in order to spend. You and I can borrow from a bank or from a friend in order to spend beyond our income. States and municipalities, they have to raise tax revenues to spend. They can borrow a little bit up to a certain limit, but that's it. They can't continuously borrow, and they can't issue money into existence. The federal government, however, can. And these are not the only two instances. What I'm arguing is that this is how the federal government always spends. Case in point, during the COVID crisis, the CARES Act, unemployment benefits. Remember, the federal government sent $600 a week for people who lost their jobs in unemployment benefits. That's essentially a living wage, working 40 hours a week at $15 an hour for millions of people. That could have been the equivalent of a jobs program to build infrastructure. Obviously, during the pandemic, we didn't want everybody to go back to work. But the point is that money was created that could have been used to build infrastructure and do things that we should do as we emerge out of this crisis. The Fed's municipal lending facility, this is not the federal government, this is the Federal Reserve Bank, created a lending program essentially for all major cities and municipalities across the country, who could now borrow up to a certain limit for up to 3 years, essentially at zero interest, just like Wall Street banks borrow from the Fed, to build infrastructure, to fully fund their budgets and so on. And that's available, and that's way underutilized right now. The Fed also has a mainstream lending facility. As a matter of fact, it's a network of lending facilities. That's also available, trillions of dollars available that most cities have not tapped into yet. So there's plenty of money available to address the structural weaknesses that we have in the economy. So the approach that I'm bringing here is called modern monetary theory, or MMT. You may have heard a lot about it in the news. So let me try to explain it in a kind of bumper sticker type of way, since we only have a few minutes, and I'd like to open up for questions so we can have time to have a conversation. So what is MMT in simple terms? So most mainstream economists and politicians, that kind of our popular understanding of what the government can afford, essentially tells us that governments are limited in how much they can spend by the tax revenues they can raise and the borrowing capacity that they're allowed to have, borrowing from private, markets. But that's it. Essentially, your limit is determined by tax revenues and borrowing capacity. So this is how much you collect in taxes, add to it a little bit of borrowing, and that's what we call your fiscal spending space or fiscal policy space. MMT is saying the spending capacity of the government is actually much larger than that. It's not unlimited, it's constrained, but it's constrained by the risk of inflation. So that additional spending space is something that we should tap into right now, but always with an eye towards that limit, the limit of the risk of inflation. So the question becomes, from an MMT perspective, what causes that risk of inflation to actually materialize? And the answer is pretty straightforward. Two things. One is the lack of productive capacity. In other words, when we run out of productive capacity, meaning skilled workers, machinery, equipment, technology to produce things, then we start causing inflation if we spend more, if we exceed that limit. The good news about productive capacity is that it's actually producible. We can train more doctors, more nurses, more teachers. We can build more hospital. Productive capacity is producible, which means we have to have a strategic plan to increase productive capacity in strategic areas so that we can avoid the risk of inflation. That's the easy part in a sense. The complicated part about the risk of inflation, or the second source, is what I call abusive price setting behavior of powerful market players. So here think of powerful companies that can raise prices because they can, because they have too much market power. Think of your telecom companies, think of your health insurance companies, Wall Street, fossil fuel companies. These companies are not in a competitive market. They have market power, they have monopoly power in some cases, and they can impose a constraint on the rest of the economy. That type of inflation risk is not going to be eliminated by spending less. It can only be eliminated by taxing and regulating their market power out of existence. In other words, by democratizing and making those markets more competitive. So whose job is to do that? It's the 535 elected officials that we send to Washington, D.C. in this democracy. Their job, we call them lawmakers, which means they make the laws, which includes taxation and regulation. So by using their authority to tax and regulate that market power out of existence to make the market more competitive, we can take this inflation limit and stretch it out. By doing that, we increase the fiscal spending capacity of the federal government. In other words, we're not going to afford a very comprehensive Green New Deal program unless we tackle the power and influence of key players in the economy. That includes the top 1%. So from an MMT perspective, we're not taxing in order to use their money to spend. The federal government can spend money into existence, but we're taxing to reduce their market power, to reduce their power and influence in politics in the first place. Because those 535 elected officials, they're not going to bite the hands that feed them. So if you're funded by super PACs from pharmaceutical industry and oil and gas companies, you're not going to do what I just proposed here, which is taxing and regulating their market power out of existence. So with that, I'd like to stop here and take questions. This is not the full MMT perspective, obviously. Will take us longer than this, but this is challenging the idea that we're constrained in terms of what we can do. And then finally, if I may drop something in the chat box just to amplify something that Dr. Ziegert was saying. I'm part of this research group called ESGX. We do a monthly webinar on green jobs. And one of the things that I'm happy to share with you, Andrea, is that what we're finding is we're looking at the jobs that are created and destroyed in the economy. We're trying to figure out how green or how brown those jobs are by industry ratings based on the greenness of those jobs. And what we're finding is that greener jobs pay better, number one. Greener jobs are more resilient during the crisis. So as all industries lose jobs, greener jobs are more resilient on the way down during the crisis. And on the recovery, as we reopen the economy, greener jobs are recovering faster than other jobs. And then most interestingly, we're finding that the Federal Reserve Bank of St. Louis has an interesting database that I'll share with you, Andrea, that amplifies some of your points there, which looks at industries and jobs by what they call high contact versus low contact industries in terms of physical distance between coworkers. And they define high contact as working within an arm's length of a coworker, low contact, further distances. So what we found when we look at that high contact versus low contact industries, the high contact industries are the ones that you mentioned, Andrea, here, which is the service jobs and so on. But even within the high contact industries, the greener jobs within the high contact industries are more resilient than the not so green jobs. So this is kind of a metric for us. If we as a country want to build a more resilient economy, a more prosperous economy, we need to invest in greener industries and greener jobs, because they're more resilient, they pay better, they're safer during a pandemic. So in other words, it's a no-brainer. This is really the path for the future. So with that, I'll stop here, and I'm happy to take questions. Thank you again.
Great. I think our first question actually comes from another panelist. So Dr. Ziegert asked, how do you define green jobs?
Very good question. So so the link that I just posted, this is a research partnership with HIP Investor, which stands for Human Impact and Profits, which is a private company based in Silicon Valley that essentially takes the Fortune 500 companies and re-ranks them based on the triple bottom line approach, based on their impact on people, the planet, but also the bottom line. So we use their metric, their industry ratings, to define which rates companies from 0 to 100, based on a HIP score, Human Impact and Profits. And then we match that database with the BLS data showing us the new jobs created by industry. We make the two databases speak to each other, and then we get the rating. So all the videos of the webinars, by the way, are posted there, the presentations, and we'll be releasing some written reports with charts in the next couple of weeks. I think we'll have a few of them coming out.
Great.
And we use the terms green versus extractive. I apologize, I said green versus brown, which is a language we try to avoid for obvious reasons.
Do we have any questions in the audience here or virtually for our two panelists?
Somebody asked earlier about the slides. I'm happy to share the slides if you email me.
So I know, Dr. Kaboub, you mentioned kind of a few potential policy responses. I was curious, Dr. Ziegert, if you had any insight on kind of effective policy responses to deal with kind of the increasing level of inequality we're seeing as a result of the pandemic?
Well, I think, Dr. Kaboub is focused on some of the issues, the difficulty of paying for housing, education, healthcare. I think we have to start everybody out from a common starting point where folks have access to those services without breaking the bank. That would be a start. And then I think with better education, better healthcare, people can better compete in labor markets.
Great.
So for example, one of the things that a Green New Deal can bring to the US economy is broadband infrastructure. We did this in the 1930s with rural electrification, especially in the South and rural areas. Today we need national broadbandification to bring access to internet and information and education and telehealth to isolated communities. So it creates millions of jobs, it builds a stronger economy, and if we know for sure that the jobs of the future are going to be driven by technology and information and artificial intelligence, then we're literally excluding millions of people from access to those opportunities by preventing people from having access to information, telehealth, telecommunication resources. So it's a no-brainer. And it's, again, putting members of the rural community in a more disadvantaged situation over time.
No, I agree with you 100%. If I could follow up with that, but that goes to your point of market power, because in Europe, telecommunications is regulated as a natural monopoly. Here it is not, and it's dominated by one or two firms, and that's one of the reasons why we don't have the kind of access that in fact we need. So I would argue that part of the economic solution might first be a political solution, and that is trying to get money out of politics. to whatever extent that we can do that. I think Citizens United has made corporate power much more dispersed throughout the economy to detrimental effect.
Yeah, and I'm glad we're having this conversation with DU votes, because if we're talking about a democracy, a government of the people, by the people, for the people, right? That's what this country is about. But now what do we have? We have a government of the super PACs, by the super PACs, for the super PACs, for the telecom companies and big pharma. That's not a democracy. And the only way to do this is to bring 535 people to Congress who take that, you know, democratic process seriously, and a government of the people, by the people, for the people. And obviously, you know, Citizens United just destroyed that whole principle.
So we've got 3 questions here, and I want to see if we can get through all of them. This question is from Charles. Charles asks, how would the U.S. structure competition within each particular industry to drive both real efficiency and technological innovation within the Green New Deal framework? So that would be for you, Dr. Kaboub, I think.
So that's a heavy question. So number one, you want to give people choices. Competition is about choices. So one of the things that we do, for example, in the telecommunications space, is that there's no competition. You know, the big companies essentially divide the map of the US into territories and have figured out a way to keep competition out, including in cases where communities of citizens and cities decide to form their own publicly owned cooperative broadband company to compete with the big companies. They actually sue them, and in many cases they win. In other words, they sue to win and protect their monopoly over a territory, and they will not improve the infrastructure, will not provide the services. They just want to dominate. So that's just not right from a legal perspective, from a you know, competitive market perspective. That's why we need to regulate telecom companies in the same way we regulate public utilities, right? And reduce their influence in politics. I mean, we're talking about corruption here. So this is a basic concept. So a Green New Deal that spends a lot of money without addressing this is not my Green New Deal.
So this next question is for Dr. Ziegert. Could you speak to how some of the slides you presented on inequality, particularly in the context of COVID, what are the tax policy implications of what you presented?
Actually, I'm not so sure tax policies are it, because for many of the lowest and middle income taxpayers, they don't pay a lot of federal tax. And so through that channel may not be the way. I would argue that what we need is better and targeted expenditures along the CARES Act. Much of the CARES Act some of the CARES Act went to people who didn't really need it. And I would argue that we would be better to target it to households that are in the bottom 3 quintiles. And so I'm not convinced that there's a lot of room in tax policy. To follow up with one of Fadhel's points, you know, the problem of inequality causes political power, leads to more political power that leads to more inequality as folks use their financial influence to affect politics. And that's a cycle that I think we as a nation really have to work hard to break. And I give the Green New Deal, you know, good luck with that. That's not going to be easy.
Right. I see a question here about the green jobs and Green New Deal jobs, and as it relates to skills and education. Well, the Green New Deal is not just one package, just like the New Deal of the 1930s. It was a series of programs. I mean, that today we call the New Deal, but it was a series of bills that were introduced. The same thing will be true for the Green New Deal. There'll be educational components, there'll be infrastructure components, housing and health components. All of these are kind of interlocking to produce the full effect, hopefully. So in terms of skills, the basic concept that the Green New Deal approach follows is take people as they are, where they are, and do on-the-job paid training. That includes technical training, that includes access to education. But the point is not to tell people, you know, move to San Francisco, learn how to code, get the certification, pay for it out of pocket with student loans, and then maybe you'll find a job in the market. Here we're designing strategically areas of the economy that need to be rapidly decarbonized and areas of the economy that need to be rapidly built with a green infrastructure and so on. And then we're taking people and we're placing them in training programs, paid training programs, so that when somebody loses their job in coal industry or trucking industry or even healthcare billing industry, which will be downsized significantly with something like Medicare for All, it doesn't mean that now we're throwing them under the bus, but they're transitioning with that job guarantee program that pays decent wages and benefits and includes educational and training benefits to transition everyone into a new economic infrastructure. That's the short answer to this.
I want to close with this question, which is certainly political, but also linked to policy. Right now on Capitol Hill, there's a pretty, widespread debate about whether there should be another stimulus package and what should be in that package. Do either of you have suggestions, to kind of help keep the economy afloat, but also on the topic of inequality? What should be in the package that Congress is considering right now? Dr. Ziegert, if you want to go first.
I mean, I think the U.S. economy is based on, 70% of the economy is consumption expenditure. So I think we have to get spending for households back up again. That's what's going to get the economy going. But the truth is, I think, as long as there's fear of the virus, I think the virus has to be controlled first before those dollars will be as effective as they could be. So I think we made a mistake by trying to open too soon, and we realized that people's fears were keeping them from spending. So I think we have to keep households afloat even when they're not at work until the fears of the virus are back and are controlled, and then the spending and the economy can revive itself.
Yeah, I agree with that. Obviously, we have a public health crisis. That's even the day we discover a vaccine and we start putting a dent in this, consumer fears and expectations and anxiety is not going to disappear immediately. So it's going to be a slow, transition into consumers going back into their usual shopping sprees and going out and everything, which means the jobs recovery is going to be slow. But in the immediate moment right now, as the CARES Act component are expiring as we speak, and millions of jobs are not created to make up for that, we need immediate support. So the concept of a job guarantee applies here too. So the most important job that people can do now, if they're not essential workers, is to stay home if they can't work remotely and so on. So that should be a paid job so that people can pay their rent. We're literally looking at a massive avalanche of foreclosures and evictions with all the consequences that we've seen in terms of their impact on the heavier burden on people of color and women and so on. So there's no way that we can deal with that unless we have federal dollars going directly to support those individuals and to support cities and municipalities at the local level who are losing tax revenues because they rely on property taxes, on sales taxes, on income tax, local income tax. And if you have people with no income, people with no spending and no tax revenues, so now your local municipalities are not able to fund the school, are not able to fix the potholes and deal with the public health crisis that they're dealing with too. So we have, caused this pandemic to have more pain than necessary by not having the federal government spend enough and continue supporting people during the crisis. And this is unfolding as we speak right now, because Congress is kind of reaching a stalemate in terms of how much are we going to put into this next recovery thing. And it doesn't help that it's right before an election, so it's heavily political, as you all know.
Well, we are at 1 o'clock, so I want to call it here and be respectful of everyone's time. I know folks have to run to class now that common hour is coming to an end. But just wanted to thank both of our panelists for joining us for this hour. I think this discussion's been both informative, but also really productive. And just kind of a closing thought here, make sure to get out and exercise your right to vote. If you've received your absentee ballot, make sure to mail that back as soon as possible. And folks also have opportunities to vote in person early in Newark every day this week and for the next 2 weeks at the early voting center of the Licking County Board of Elections, and then election day in Granville at First Presbyterian Church from 6:30 a.m. to 7:30 p.m. Thank you so much. Really appreciate everyone joining us.
Thank you. Appreciate it.
Thank you.
Take care. Bye.